Understanding erectile dysfunction, its causes, and how to seek help. Introduction. Erectile dysfunction is one of the most common sexual health problems that men face, yet it remains an area many feel uncomfortable discussing. It can happen to men of all ages, although it becomes more common as men get older. If you're asking, do I have erectile dysfunction? You're not alone. Many men experience occasional issues with their erections, but if it's happening frequently, it might be time to explore the topic in more depth. Erectile dysfunction refers to the consistent inability to achieve or maintain an erection sufficient for sexual intercourse. While occasional erectile issues are common, persistent problems may be a sign of a deeper health issue. Understanding what erectile dysfunction is, what causes it, and how to address it can empower you to seek help and make the necessary changes to improve your sexual health. What is erectile dysfunction? Erectile dysfunction is defined as the inability to get or keep an erection firm enough for sexual activity. Erectile dysfunction can occur occasionally, but when it happens regularly, it can affect your self-esteem, relationships, and overall well-being. An erection is a complex process involving the brain, hormones, nerves, and blood vessels. Any disruption in this process, whether from physical or psychological causes, can lead to erectile dysfunction. Physical and psychological components. Erectile dysfunction can be either physical, psychological, or a combination of both. Physical erectile dysfunction. This type is often caused by issues with blood flow, nerve function, or hormone imbalances. Psychological erectile dysfunction, stress, anxiety, depression, and relationship issues can also contribute to erectile dysfunction. In many cases, both physical and psychological factors can interact, leading to a cycle where stress about erectile issues makes the physical problem worse. Common causes of erectile dysfunction. Understanding the potential causes of erectile dysfunction can help you identify whether you might be experiencing erectile dysfunction. Here are some common factors. 1. Physical causes. Cardiovascular problems. Conditions like high blood pressure, high cholesterol, and heart disease can impede blood flow to the penis, making it difficult to achieve or maintain an erection. Diabetes. Diabetes can damage blood vessels and nerves, both of which are essential for sexual function. Men with diabetes are more likely to experience erectile dysfunction, especially if their blood sugar levels are poorly controlled. Obesity. Being overweight can cause a variety of health problems, including a decrease in testosterone levels, which can affect sexual desire and performance. Obesity can also lead to cardiovascular issues that restrict blood flow to the penis. Hormonal imbalances. Low levels of testosterone can lead to decreased libido and erectile dysfunction. Hypogonadism, or the inability of the testes to produce enough testosterone, is a condition that can contribute to erectile dysfunction. Neurological disorders. Conditions such as Parkinson's disease, multiple sclerosis, and spinal cord injuries can interfere with the nerves that help with erections. Medications. Some prescription medications, including antidepressants, antihypertensives, blood pressure medications, and medications for prostate conditions, can cause erectile dysfunction as a side effect. Alcohol and substance abuse, heavy drinking, smoking, and drug use can damage the blood vessels and nerves involved in the erectile process. Alcohol, in particular, is a common cause of temporary erectile dysfunction. Sleep disorders. Conditions like sleep apnea can interfere with the body's natural rhythms and testosterone production, contributing to erectile dysfunction. Psychological causes. Stress and anxiety. The pressure to perform sexually can lead to anxiety, which in turn can interfere with your ability to get or maintain an erection. Performance anxiety can become a self-fulfilling prophecy, where worrying about your ability to perform makes it harder to get an erection. Depression. Depression can lead to a loss of interest in sex and difficulties achieving or maintaining an erection. Additionally, Medications used to treat depression, particularly selective serotonin reuptake inhibitors, SSRIs, can have side effects that cause erectile dysfunction, relationship issues, problems with communication, trust, and intimacy in a relationship can affect your sexual health. Conflict or emotional distance with your partner can lead to sexual difficulties, including erectile dysfunction. Past trauma, past sexual trauma or experiences with abuse can affect your ability to engage in healthy sexual relationships. Psychological trauma can lead to erectile dysfunction, as the body associates sexual activity with distress or fear. Symptoms of erectile dysfunction. The primary symptom of erectile dysfunction is the inability to achieve or maintain an erection sufficient for sexual intercourse. This can manifest in various ways, including difficulty getting an erection at all, difficulty maintaining an erection long enough for intercourse, a decrease in sexual desire or libido, premature ejaculation or delayed ejaculation. If you're experiencing any of these symptoms frequently, it might be time to consult a healthcare professional for an evaluation. When to seek professional help? While occasional difficulty maintaining an erection is common, if you notice that these symptoms are happening regularly, at least 25% of the time, it's important to seek professional help. Erectile dysfunction may be a sign of an underlying medical condition that requires treatment, or it could be a signal that there are psychological factors at play. Here are some signs that it's time to see a doctor. Persistent erectile dysfunction. If erectile dysfunction occurs frequently and does not improve on its own, it may be time to get a professional evaluation. Underlying health conditions. If you have conditions like diabetes, heart disease, or high blood pressure, or if you are taking medications that could cause erectile dysfunction, it's important to speak with your doctor. Psychological struggles. If you're feeling anxious, stressed, or depressed about your sexual health, or if you believe that emotional or relationship problems may be contributing to erectile dysfunction, seeking therapy could help. Decreased libido, a loss of sexual desire, in addition to erectile dysfunction, could indicate a hormonal imbalance or an underlying psychological condition. Diagnosis of erectile dysfunction. To diagnose erectile dysfunction, a healthcare provider will first ask about your symptoms, sexual history, and medical history. They may ask questions like, when did you first notice erectile dysfunction? Do you have any chronic conditions, diabetes, hypertension? What medications are you taking? Are you under significant stress or anxiety? In addition to a physical exam, a doctor may recommend tests, such as blood tests, to check for diabetes, cholesterol levels, testosterone levels, and other health issues. Urine tests, to check for underlying conditions like diabetes or kidney disease. Ultrasound, a test to check blood flow to the penis. Psychological evaluation. If psychological factors are suspected, a counselor or therapist might be involved. Treatment options for erectile dysfunction. There are several treatments available for erectile dysfunction, depending on its underlying cause. Treatment options include 1. Medications. Oral medications. The most common treatments for erectile dysfunction are medications like sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra. These medications increase blood flow to the penis, making it easier to get and maintain an erection. Hormone therapy. If erectile dysfunction is due to low testosterone, hormone replacement therapy, HRT, might be recommended to restore testosterone levels. Lifestyle changes. Exercise. Regular physical activity can improve blood circulation and boost testosterone levels, which can help with erectile dysfunction. Diet. Eating a balanced, healthy diet can improve cardiovascular health, which is vital for erectile function. Stress management. Reducing stress through mindfulness, therapy, or relaxation techniques can alleviate the psychological factors contributing to erectile dysfunction. Quitting smoking and limiting alcohol. Reducing or eliminating smoking and alcohol consumption can improve erectile function. Psychological counseling. If psychological factors such as anxiety, depression, or relationship issues are contributing to erectile dysfunction, therapy can be helpful. Cognitive behavioral therapy and sex therapy are common approaches. Vacuum devices and surgery. Penile pumps. A vacuum pump can help create an erection by drawing blood into the penis. Penile implants. In severe cases, a penile implant may be surgically inserted to help with erections. Conclusion. If you're wondering whether you have erectile dysfunction, the key takeaway is this: you're not alone. Erectile dysfunction is a common condition, and it can happen for a variety of reasons, both physical and psychological. The important thing is to recognize the signs early, take action, and consult with a healthcare provider who can help identify the root cause and offer appropriate treatment options. By addressing your health, reducing stress, and communicating openly with your partner, you can take steps toward overcoming erectile dysfunction and improving your sexual and overall health. Remember, erectile dysfunction doesn't define you, and it's treatable with the right approach.